I'll provide a brief introduction, a background, and mainly talk about some of our One Health initiatives and our current priorities. Thank you. The slides are on. The next slide, please. Next slide, please. Yes. So, colleagues, as you know, diseases that circulate in animals or have an animal reservoir and can spread rapidly from person to person cause serious health emergencies, such as the recent epidemics of Ebola virus and monkeypox, as well as the COVID-19 pandemic as well. Now, these risks increase with globalization, climate change, and changes in human behavior, giving pathogens numerous opportunities to colonize new territories and evolve into new forms. Next slide, please. So the COVID-19 pandemic demonstrates the importance of multi-sector action for research, prevention, preparedness, and response measures for the control of communicable diseases and pandemics. There are multiple calls for One Health approaches to inform research and decision-making. The overarching coordination body for outbreak response at the National Department of Health is the multi-sectoral National Outbreak Response Team, and we often refer to it as NOHF. Now, proper records and those kind of things. So we're saying that there's not yet a revisit. That's what to the point that we listened to the that they raised a Hi, can you hear me?
Yeah, sorry, Wayne, you got muted, sorry.
Oh, okay, thanks. I'm not sure where I stopped.
20 seconds back.
Okay, let me start off with the second bullet. Is that okay? The overarching coordination body for outbreak response is the Multi-Sectoral National Outbreak Response Team, often referred to as MNOT. Now, MNOT is led by the National Department of Health, with support from the NICD, WHO, the USCDC, University of Pretoria, and several other partners. Several other departments are also involved, and they include Department of Agriculture, Department of Home Affairs, Department of International Relations, as well as Department of Transport, and so on. So these multi-sectoral, multidisciplinary coordination structures are also reflected at provincial and district levels, and some sub-district levels have also adopted these structures as well. Next slide, please. Yeah. So the South African population are mainly affected by endemic pathogens that cause diseases such as Congo fever, Rift Valley fever, and rabies. In addition, antimicrobial resistance, or AMR, due to extensive use of antibiotics, is also of great concern locally as well as internationally. Now, public health systems are impacted by and must respond to these threats at the human-animal-plant environment interface. Therefore, public health systems must be resilient and prepared to face existing and future disease threats and implement interventions at this level, which is the human-animal-plant environment interface, in an integrated manner, as these would have, in the long term, shared benefits across the sectors. Now, the complexity of interactions along the interface requires strong and consistent collaboration. And among the sectors responsible for human health, animal health, and the environment. Now, recognizing this fact, the National Department of Health facilitated the establishment of the One Health Forum and the One Health Steering Committee that Dr. Bayer had spoke about earlier on. Next slide, please. Next slide, please. So, as Dr. Bayer also mentioned, there were several activities that the One Health Forum and the One Health Steering Committee have undertaken, and these include outbreak response, These include rabies, influenza, COVID-19, and so on, as well as development of guidelines and IC material. We've conducted research, example, on brucellosis. There were several communications and newsletters and joint events that have taken place. And these include joint One Health days and joint rabies day celebrations and so on. So we also have One Health committees, several of them, and these include the One Health Forum, the One Health Steering Committee, the Rabies Advisory Group, the Brucellosis Steering Committee, as well as the Neglected Tropical Diseases Technical Working Group and the Vector-Borne Disease Technical Group as well. As Dr. Bayaz mentioned, we are in the process of conducting a mapping exercise, as there are several other working groups and several other institutions that are conducting One Health activities. So we need to really have a comprehensive view of all these activities that are taking place. Next slide, please. So our current priorities include participating in the process of the drafting of the regional One Health program for Southern Africa, together with other SADC members. So this is a policy that is being developed and that is led by the FAO. We've conducted the National Bridging Workshop in August 2023. We shall hear more about it later. We are in the process of aligning our National One Health framework with the Global One Health Joint Plan of Action and the SADC One Health program. We'll hear more about this later on as well. Currently, we are in the process of drafting the National Pandemic Preparedness Plan, and this involves incorporating One Health approach and the multi-stakeholder engagement as well. We conduct annual zoonotic disease co-capacity assessments and scoring, and this is a requirement of the international health regulations and the joint external evaluation. So the next joint external evaluation is planned for this year. We'll hear more about it in coming weeks. At the moment, we are engaging with stakeholders to establish One Health platforms at the provincial and the local levels. And following the stakeholder engagements, the National Action Plan for Health Security, often referred to as a NAPS, was updated with priority activities that the One Health Forum needs to consider. So next slide, please. So I thought I'd spend a couple of minutes highlighting the international health regulations and the various activities that we will be embarking on. So these activities were actually derived from the after action reviews of the COVID-19, the joint external evaluations, and all other activities involving, all other assessments involving animal health, human health, and environment as well. Okay, so colleagues, in 2022, we conducted the core capacity assessments for zoonotic disease, and we scored ourselves 3. And last year, in 2023, the score has not changed and we remain on 3. Now, for us to move to the next level, we need to, currently, there are activities taking place where we look at a select group of diseases, and these include influenza, Ebola, rabies, Rift Valley fever, and so on. And we mainly look at those diseases, and collaboration is mainly taking place at the national level. So for us to move to the next level, which is level 4, we need to include the majority of zoonotic diseases, and we need to move from mainly national level to the subnational levels, which includes the provinces and the lower levels as well. So we need to bring the lower levels on board for us to progress further in terms of the national health regulations and zoonotic disease, One Health. Next slide, please. So as I mentioned, we have conducted the National Bridging Workshop. We've conducted the joint external evaluation and several other assessments during COVID-19. And we came up with a set of activities. And I'm going to spend just a couple of minutes to highlight some of these activities. So these are busy slides. I'm just going to focus on activities to give colleagues a picture of some of the activities that they can be involved in as well. So number one, we need to sustain and strengthen the National One Health Forum and the One Health Steering Committee. Number two, we need to establish One Health platforms at provincial levels. Number three, we need to develop operational plans, and these should be include communication and implementation strategies at national, provincial, and local levels. And very importantly, we need to include real-time reporting. And we should include some of the priority conditions such as rabies, Ebola, Rift Valley fever, and so on. Next slide, please. Okay, we also need to develop systems for joint collaboration between human and animal health laboratories. So this is really an important area that we need to focus on going forward, where we look at collaboration between the laboratories. We need to implement the integrated sector plan for rabies. It is in progress, but we need to really step up our activities so that we can reach the targets that we agreed on. We also need to develop and implement an integrated sector plan for influenza. We shall have a discussion on influenza later on, but we need to look at how we really develop a plan where all sectors are involved. We also need to conduct training for animal and human health stakeholders on zoonotic diseases. Next slide, please. Okay. I think you skipped the slide. Okay, so very importantly, colleagues, we also need to conduct the field epidemiology program basic course for human and animal health stakeholders at provincial level. We need to conduct additional training for our One Health colleagues. And we also need to conduct simulation exercises really to test our plans that are available, but also need to look at how we are performing and what other areas that we need to build upon. Next slide, please. Yeah, next slide. Yeah. So as a way forward, colleagues, we need to strengthen health systems to be resilient and prepared to face existing and future disease threats. The various sectors need to join forces to support One Health approaches effectively to detect, respond, and prevent public health events. And we really need to adapt the One Health joint plan of action. We need to encourage collaboration and sharing of resources. And here we really need an integrated One Health surveillance system. Professor Makoto had mentioned some of those issues earlier as well. We need to support the IHR implementation activities and conduct regular monitoring and evaluation. And we need to strengthen One Health approach nationally, regionally, and globally. Thank you.